joining us. My name is Mallory Steiger. I am the Director of Communications here at Southeastern Michigan Health Association, also known as SIMHI. And today, as the holiday season approaches, we wanted to highlight our community health workers, also known as our CHWs, and just say that we are grateful for you all. We are thankful for you all. And we wanted to highlight one of our CHWs. So on today, we have Adrienne Bulger. She is a community health advocate at Hope Village Revitalization. So hi, Adrienne, how are you? And thank you for joining us.
Hi, Mallory. Thank you. I appreciate you for having me here today. Thank you so much.
Wow. So why don't you just start off by telling us what your role entails and how long you've been a CHW?
Thank you. So my name again, Adrienne Bulger. I am the community health advocate for Hope Village Revitalization. I play a pretty significant role here when it comes to health and wellness in the Hope Village community. I actively facilitate health and wellness programs within the community, those that promote healthful living. So what's understood is that there is a critical need for those our residents living with chronic disease, to have support as well as community beyond their doctor's visits. I have a heart for compassion. I do understand, it kind of stems back a while now, understanding that human services are provided to citizens. And sometimes, the services don't always go as planned. People run into blocks when receiving services. So, I'm like, how can I help that? How can I make this a better process for people that actually need services or that need resources and don't know how to get them? So I took on the role, kind of like I was born into it, raised into it, to be loving and caring for people. SIMHA has actually placed me in position to understand what it truly means to be a community health advocate, community health worker. I've been able to be blessed and be, I guess you can say, in the same room as other community health workers that understand that it's more than just a job. Yes, we show up for work, but there's a true need that humanity has, and we show up. And when we have conversations on what it looks like to be a community health worker, we share stories on some of our experiences. So it allows for me to be very well-rounded in understanding the role, and not just what I serve in terms of helping people with managing their chronic disease or preventing their chronic diseases. There are people that are living without shelter, that actually need support in various services. There are people that don't receive enough food. So when having these conversations with my colleagues, I'm able to better understand my role in what I do. Someone may not have access to healthier food. So can I reach into my community at SIMHA to say, do you have this resource available? How can we help here? So it has absolutely helped me to become very well-rounded in my role as a community health worker. SIMHA is a great program. I think that having the opportunity to build and connect with other community health workers has really, really enhanced my experience as a community health worker. When I took the training, yes, there are people that are like me, but with SIMHA, we all get to come together. We all get to understand each other's roles and how we work together. Not just I do this, we all do it. So it's a collective effort that strives to make community health workers better. We have support, we have engagement, we have tools and resources. So I love that about this, my role in SIMHA. But what I love more importantly about being a community health worker is that I'm presented with the opportunity to change lives. Not just because it's who I am as a person, but to be supported by an organization that believes that it's important for people to have quality life, right? Like the quality of life is very, very important. And even though things may look away, how important is the quality of life to people? And so we're able to highlight that not only being healthy, but having mental health in a healthy state, physical health in a healthy state, a healthy environment, it's important. And so SIMHA has been able to show me I've been able to see what this looks like by communicating with my colleagues and actually applying. Stories shared are very, very real, from people not being able to make ends meet, people looking for resources on how to receive housing. Being a part of this, each story that I hear helps a bit of me grow to say, I have this resource for someone. So as we share, we come to these meetings, and community members ask questions, it puts me in their position to say, you know what, this is an environment that will help. Watching our residents actively take control of their health and to say, I want to be better. Those are the impactful stories, but the one with the participant who could not walk into the park or lift their arms above their head, they were physically active and had more mobility by the time that they were done with that session. And so it took 3 months, and that's fine, because they were still able to start from where they were and to improve themselves. And so those are the stories that matter to me the most. Those are the outcomes that I hope that our participants desire for themselves, to start where they are, but to become better. And even if it doesn't happen immediately, which it truly never does from my experience, even when we go cold turkey on behaviors, there's still time for our lives to improve. So having that experience inspired me myself to make sure that I get up and take full advantage of the full activity and use of my mind and my body every day. Additional funding is great for a community. What that allows for is sometimes there's a need. Let's say, for example, there is a community health center or a recreation center, excuse me. The person may want to go, may want to attend, but they don't have transportation to get there. This could potentially add funding for transportation, for people to be able to be picked up from their homes or to use public services for transportation. A bus pass can go a long way. Maybe, there's new technology, an Uber or a Lyft ride can be taken care of for a resident. Understanding that there are, again, parts of the social determinants of health that people may not have access to. So transportation, having additional funding may be providing meals for people. It could be healthy meals, non-perishable items where people can stock up on. It could provide bringing in fitness coaches, wellness coaches. It could be providing services for mental health for people to have access to see care, particularly the role of the community health worker. It could pay for time, continuous education, as well as community partnerships. How do we have these large events or we can have large events, bring community out, give them exposure to all things health and wellness, starting with the transportation, going to housing, going to mental health, physical activity. So there's lots that additional funding can do for both the community health worker, the agency, as well as the communities in which are being served and serviced.
Okay. Is there anything additional you'd like to share that we didn't highlight?
My goal for the Health Village community is to create a lasting impact with health and wellness resources that will continue to thrive, that will become a ritual for folks to get up, be healthy, drink their water, get their physical activity in, understand that prevention and management are key when it comes to chronic diseases, and so that there's resources and support that is available to them. Whole Village Revitalization, our health and wellness program, is continuously growing. It's only going to get better because we have community members that actively want to live a healthy lifestyle. And so we give them what they want. We ask them, they told us, and so we're providing it. So I absolutely love that I'm in this position to be a health leader in the Hope Village community, working as a community health worker. It's been very, very impactful. I've inserted myself into the blood pressure programs in which we have. I've reduced my sodium intake, which is in turn giving me a healthier blood pressure. And so I I engage with what it is that I facilitate because I too want to experience what it is that I'm asking residents to do for themselves in the form of prevention. And so I'm fully engulfed, I'm fully engaged, and I'm here to serve the community.